Welcome again, everybody, to a new video in the series of the common radiographic errors encountered with the angle bisecting technique. In this periapical radiograph, which is supposed to be for an implant replacing the upper 6, you can see that there is a problem in the film positioning. We must always take care that when we place the film, we should keep in mind is that the distance between the margin of the film and the buccal cusps of teeth should be not more than 2 millimeters. Should be not more than 2 millimeters. If it is the idea behind this is that we want to guarantee that the apex of the crowns to be seen in the radiograph. If you have a look at this radiograph, you see that the margin of the tooth, margin of the film is well over 2 millimeters. There was a chance to capture the apices of these teeth, but if you see that as the distance increase between the margin of the tooth and the margin of the film, we will have a loss of the apex of the teeth. So to avoid this, the film should be placed in a way so that the margin of the film should be equally extended from, or should be equal from the very beginning of the film, the anterior part, to the last part. So the 2 millimeters would be even all through this distance. This is the best way to guarantee that the apices of all the teeth, or the periapical area, even in an edentulous area, it will be seen. So the film has gone down. Unfortunately, what happens sometimes, as if we go back to the video of the demonstration on the periapical angle bisecting technique, we will see that most of us will look at the anterior margin of the film and make sure that it is only 2 millimeters extending below the, or above even the occlusal plane, and we forget to look at the other end of the film, and this is what happens. It goes down, it doesn't follow the curvature of the arch, and we will have a cutoff in the apices of teeth. The same problem is repeated in this radiograph, as you can see here. Here, in the anterior part of the film, it is less than 2 millimeters, so we have a crown cutoff. But as we go posteriorly, you see that the film is slanted and it doesn't follow the curvature of the arch. So the apical part of teeth is all cut off here. Though the horizontal angulation, the vertical angulation, the cone coverage are all fine, but what changes this radiograph to an unusable one is the fact that the film is extending below more than 2 millimeters, and thus we will have a cutoff in the apical area. The same problem here. We overlook the posterior part of the sensor when we place the film, and we only concentrate on its anterior part. Another radiograph for a lower jaw for a pedo patient. See the distance here from the margin of the occlusal surface of teeth and the margin of the film. Especially in the lower teeth, and I want you to go back again to the video in which we demonstrated the lower premolars and lower molars, and there was a way to avoid this, to guarantee that the film is pushed down all the way down to the floor of the mouth, so that we guarantee that only 2 millimeters are extending off the film above the occlusal plane, at least we will, and this is the only way where we can get the apices of the teeth. And the way, if I may repeat it here again, you put your fingers on the floor of the mouth from outside in the area exactly opposite to where the film is touching, and you ask the patient to release this area. What happens is that patients, when you put the films or the sensors, when you try to push them against the floor of the mouth, as a reflex they will make all these muscles tense, which prevents the pushing down of the film in an apical direction. The only way to overcome this is to change the point of attraction for the patient from the area where the sensor is touching inside the oral cavity, and you direct the beam to loosen the area, and this is why you put your fingers on the floor of the mouth from outside. This will guarantee, or this will make all the muscles of the floor of the mouth to be loose, and thus you can press the film downwards. In this radiograph, the contrary has happened. See that all the crowns of the teeth in this periapical area were cut off, and the film has extended too much down see this radio-opaque area. This is actually the inferior border of the mandible. So what happened here is that the operator has pushed the film so much down, actually much less than 2 millimeters above the occlusal plane. Thus the crowns of the teeth were cut off, and the coverage area were more than what we want from the periapical area of the teeth. This is justifiable though if you want to see the area in the bone, in the mandible, in the body of the mandible. Okay, so you want to extend, or you want to show area more than or be apical to the apex of the teeth, then it is advisable to push the film downwards if the patient allows you to do so. Otherwise, if you're doing only a periapical radiograph, you will have a cutoff of the crowns, and definitely we need the crowns in the periapical radiograph. There is another problem here, is the cone cutting. I guess you know what is going on here. The operator has failed to ask the patient to remove the acrylic partial denture, and these are the clasps that are embedded in acrylic. And this is unfortunately a problem that keeps on repeating. Because we are in a hurry, we don't ask the patient to remove anything inside the oral cavity that might interfere with the film placement, and or it might cast a shadow, whether it is metallic, whether it is acrylic. All removable. Anything that can be removed from inside the oral cavity should be removed, except those like things that cannot be removed, bridges, for instance, crowns, retainer, the orthodontic bands and retainers, and so on. Otherwise, the image will show. Suppose you want to see a pathology over here. This the stainless steel clasp will mask the area. If this radiograph was of a lower density, you can even show or see the teeth in this area. Again, this is a contraindication, because you want to see areas that you want to see a clear area that is not covered by any foreign object. Same problem repeated over here. See the clasps, and they are left with the denture, with the acrylic denture, with a removable partial denture, and it is the operator has failed to remove them. You see all these areas, whether in the crown, suppose there is a cavity over here, or a carious cavity, it's completely blocked, even here, even here. All this image, because this is metal, it's going to absorb the X-ray, and thus it will cast its shadow on the radiograph, and thus it will block the whatever you want to see. Have a closer look at this radiograph. What do you see? You see that there are two radiographs taken on the same film. This is a radiograph of the lower teeth, molars, 1, 2, 3, 4, and there is another radiograph which is taken on the same sensor, another one, 1, 2, and there is overlapping over here. So what happened here is double exposure. The film has, or the sensor has been exposed twice because we are in a hurry, we forget to take or put aside all those sensors that were exposed. So a good practice here is that whenever you expose a film or a sensor, try to put it in a cup, a disposable cup, okay, so that you are definitely sure you're not going to expose that sensor again. Otherwise you end up with a completely useless image, and then you need to expose your patient again. In this radiograph you will see that we have overlapping of the margins. Can you see here, over here? This is overlap, this is overlap. However, this is the only good part of the radiograph that has been done. So here there is a failure in directing the cone in a horizontal angulation. This is one. Two, there is some sort of distortion in the image and shortening due to the increased vertical angulation. Have a look at the roots over here. This is the mesiobuccal and the distalbuccal roots, and there is another root over here. Can you see it? And this is distorted, totally distorted because of the horizontal angulation. The third thing that we have, again, there is a failure to keep the same distance between the occlusal surface of teeth and the margin of the film. The film has not followed the curvature of the arch, but it was okay, it was acceptable, but the again, not the total coverage as you would expect it to see the proper thing here. When you extend 2 millimeters, you will expect the whole, you will see the whole periapical area. If you go, if the sensor goes below more than 2 millimeters, there will be a cutoff in the apical area. Another radiograph where the film has been pushed too much downwards, we ended up with complete absence of the crowns of teeth, and the film has gone well beyond the apical part. And this is and then we can say the crowns can be seen in the clinical examination, because there are areas that can be only seen by a radiograph. That's why we are doing a radiograph. The film has gone much less than the 2 millimeter distance between the margin of the film and the occlusal surface of the teeth. So we end up with showing a broader, larger area of the periapical area of teeth.